Mike McNamara here from the SITREP, and we're very honored to have Greg Matos here today from the Boston Vet Center. You're the director over there.
I am.
Tell us about yourself. You're a veteran. Tell us what you did. What'd you do in the military?
Yeah. So Mike, first of all, pleasure to be here.
Awesome.
So excited you got the SITREP going, and I think it's going to have an actual impact on being able to get the word out to veterans. So that's why I'm actually really, this is meaningful to me to be here today.
We're glad you're here today.
Yeah. So I was a sergeant in the United States Marine Corps, so I'm glad that this is behind me right now.
You got the flag on Iwo Jima.
And so I served in 2002. I joined, I had gotten into the delayed entry program right before 9/11 happened. And so if you can imagine, I think you were in a little bit before me, yeah?
86.
Yeah, exactly. Just a little bit.
Just a little bit.
But if you can imagine, being one of the so-called 9/11 Marines, the folks going into recruit training early 2002 with that mentality in mind that you really were serving your country, you really were going to make a difference, and really believing in that. And so I joined then, and I served in the Marine Corps for a little over 4 years. I had the fortune of being selected to work with the Department of State as a Marine Embassy Guard. And I was stationed at the embassy in Ankara, Turkey, the consulate in Jeddah, Saudi Arabia, and the embassy in New Delhi, India. Unfortunately, we were attacked actually in the U.S. consulate in Jeddah, Saudi Arabia in 2004, and had to defend with my fellow Marines that consulate during that time. And so I have a very visceral, personal connection to the importance of the work that we do at VA and the work we're doing at the vet centers. And not as a side note, I went back in the Navy to work with my fellow Marines as a lieutenant, then lieutenant commander, working at Naval Hospital Camp Lejeune last, before I dove into the reserves, which I know some of your team here is still on the reserves, actually.
Correct.
So I got about 11 years in time and a few years at the Vet Center in Boston, and it's an amazing place. And I'm glad to be able to talk about vet centers broadly today.
Well, that's great, and it's a great segue. Tell us what is a vet center? So, we throw that term around a lot. We're very familiar with it, but there's people out there that don't understand the differentiation between VA, vet center. So go ahead and tell us what it is.
Yeah, and I'll tell you this through the lens of what I think in 1979, when the vet center program was initially established. I want to talk about the vet center and through the lens of a Vietnam veteran coming back from that war and really coming back to their community. So maybe it's Boston, maybe it's all over the country, and really having the question, who can I turn to and trust? Where is there a place that I could feel safe? Where can I figure out who I am now after having gone through that experience?
Right.
And what's next? And so the vet center is that place in Boston and across the country. We're not at a VA, right? We love the VA. We're part of the VA team.
You're part of the VA team.
We're all on the same team. And we all have the same mission. But at vet centers, we're really focused on providing that place where anyone, back in 1979 to today, we're those people, we're your people, we're the people you can trust, we're the place that feels safe. And there's such a plethora of things that we're aspiring to do to serve our fellow veterans and their families that sometimes it's hard to define what a vet center is, because it's just so much that we actually do and so many people that we actually serve.
So kind of go into that a little bit. So you're right. So a vet center's there for veterans, and you're right. They're all over the country. Every state has at least one vet center. Obviously, many states have multiple vet centers, depending on the size of the state and the size of the communities. But what can a vet expect? So I'm interested. I'm a veteran.
Yes.
I've heard of it, but I don't really know. Do I need mental health counseling? Is that all they do?
Yeah.
What can I anticipate?
Yeah. Listen, and I'm talking from my heart right now. And the beautiful thing about the other 300 vet center directors like me across the country and the teams that they lead, those expert counselors and psychologists and social workers and marriage and family therapists, those teams all across the country, we're really dedicated to that veteran. You, me, your team in this room right now, you initially from the very beginning, Mike, from the very beginning, you're still on active duty, you're still in uniform, you just got back from a combat deployment, or you're experiencing military sexual trauma. So that's sexual assault or that's chronic sexual harassment. You're still in uniform. We want to meet you. We want you to come into the vet center. We want you to step in. We want to help you make sense of those hard memories. We want you to navigate adjustment to that at the very beginning, let alone when you transition off of active duty orders.
So I think that's an important point you're bringing up, and that is it's not just veterans.
No.
You're actively serving.
Yes.
Active duty, reserves, guard. I mean, if somebody's on duty currently and having an issue, they can turn to the vet center.
Listen, Mike, we want them to turn to the vet center.
Okay.
We want them to have the sense that they can pick up the phone, because it's reality. This is the truth. Where are the people they can turn to coming off a combat deployment, experiencing military sexual trauma, even when they're still on active duty? And I experienced this when I was on active duty myself in the Navy as a lieutenant at that time, connecting folks to vet centers near Camp Lejeune, North Carolina. So we want them to be able to walk in. So readjustment counseling is the primary thing that we're dedicating a lot of our energy to. Why do we dedicate so much energy to readjustment counseling? That's the kind of mental health stuff that you're talking about right now. It's because we understand on a deep visceral level, 70% of vet centers are combat veterans. The director, the team members, the outreach specialists, a combat vet, administrative staff. So we get some aspect of what it means to serve in uniform. We're not going to understand everything, right? You and I could be in the same exact experience, right? And have completely unique experiences. And so we want people to understand active duty after you get out. If you're an eligible veteran, and I've described a little bit of that eligibility so far, if you're a service member, if you are a National Guard or Reserve component, having been on active orders, serving in that capacity, and all of their family members.
That's key. I mean, because obviously at the VA, you can't bring, your family doesn't get the same services, if any services.
It's challenging.
It's a little bit more challenging for the veteran. The services are set up for the veteran.
Yeah.
That's not so at the vet center.
No, I'm so excited about this, because I recognize, as do you and everybody else who may be listening and watching this right now, that military service impacts the service member. It impacts anyone they love in and around them, and it ripples out into the community. So being a local vet center, 300 of us, and 83 mobile vet centers and community access points all across the nation, being able to provide them an opportunity to kind of understand these things, work through these experiences, and get that readjustment counseling. Listen, we're focused on, again, I'm mentioning, working through hard memories, making sense of that, making sense of your service in and around that, working with couples and families through transition points. If you've never had a kid before and you're expecting to have a kid, hey, that's a great time to reach out to your local vet center. Connect, bring your partner, come talk about what your expectations are about that next transition. So I think one thing that people don't understand is actually for the rest of your life. This is in 1983. This became a permanent benefit. So the year I was born, this became a permanent benefit. It was initially temporary. 1979, they set up these 80 vet centers. So let's see what happens with this, right? But you can recognize how much power there is in what we've been doing for the last over 40 years because of the impact we've made. We can help these couples. We can help families, and we can work with and walk beside family members who have lost a loved one in service to our country. So that's our primary mission when it comes to readjustment counseling. And that is where a majority of our energy goes at the local vet center level. That's not all we do.
Right, and I want you to touch on that because, somebody watching this may feel, well, I don't have any life-altering expectations right now.
Yeah.
I don't feel I have any issues for readjustment.
Yeah.
What else can I do at a vet center?
Yeah. First of all, I want to push back on that a little bit.
Okay.
Because I think, I truly believe this. I truly believe this. When you wear the uniform, and if you served in combat, okay, if you've served overseas in support of a combat mission, or even if, and our eligibility gets a little complicated, but we got folks who are, manning unmanned aerial craft, etc. Sometimes those are domestic operators. We work with those folks as well. So anybody in support of a combat mission or experience, again, this horrendous thing of military sexual trauma, we want to make sure that they recognize, listen, you don't have to be in crisis, okay? You don't have to be struggling. We want to meet you regardless because we're your local vet center. We're part of the community, right? So you have your primary care doc, right? You've got your dentist. You've got maybe a place of worship that you go to, and you got your vet center. Okay, that's. We understand the strength.
Those are the four legs. That's the four legs of a good life. Is that what you're saying?
So maybe, but yeah, the important thing here is that really we want to be not just in crisis, not when I'm struggling. Just we want you to make sense, think through your deployment, your experiences, right? However, in addition to that, we want to build strong community because we understand that it's all about strong community. It's about strong families, right? It's not just individual folks. And so we work with listen, if I can give you a very short example.
Go ahead.
Just yesterday, I was working with a Vietnam veteran who was confused about their medication stuff, right? They're like, oh, this just changed, and am I supposed to start this or end this or whatever? Okay. Within 5 seconds, I messaged his prescriber at VA, got clarity on what he needed to do, and during that telehealth session, because I am on telehealth on VA Video Connect with this veteran, I communicate to him, please keep taking this medication and this medication. And he says, Roger that. And I said, see, VA works. This is when it works, right? And that's the beauty of the vet centers, because we are like conduits. We're like super connectors in a community. So we want to be that person you connect with initially sometimes, because we're going to connect you to your VA team. We're going to connect you to community. And we're also going to develop our own programming, right? So we celebrate the holidays every year at the Boston Vet Center. We get together as a family and we celebrate that together, and we share good music. A couple of years ago, I had a Marine, actually, I won't say his name, but he just an amazing Marine, and he rocked out on his guitar. He volunteers at the Boston VA healthcare system. He rocked out his guitar at this holiday party, and we had such a wonderful time. So it really is about us building community at the vet center, because we already have that community, but also bridging and being a bridge for veterans who are transitioning. And even if, listen, you might have come back from your deployment to Vietnam over 50 years ago.
Right.
We want you walking through the door too. We want to talk to you too. All right. We want to connect with you too. So regardless of where you are in your life, we want to be connected to you. And regardless of how in a crisis we want to be connected to, yeah. And we will do fun things.
And I think that's the key. Being a neighborhood organization, if you will, that obviously you have a very counseling specific mission, but it's not all you do.
No.
And a veteran, he and his family, or she and her family, can experience the vet center without necessarily having to be totally plugged into counseling services.
Exactly. Because, well, first of all, we're just a family, a community, right? So we know, so everybody who comes to the vet center, they can look and they probably will know my dog's name, so we know each other, we get that community. And folks are across the country, they're, kayaking together, they're writing books together, they're producing video content together. They're doing all sorts of things together with them and their families that build meaning and purpose and connection, right? And so you can get at that in lots of different ways. But at the end of the day, we want to support veterans and their families navigating a readjustment and reaching their fullest potential. And we think there's lots of ways to get at that. There's lots of ways to support that and support families and empower families and individual veterans. And we're going to be creative and innovative, as we always have been for the last 40 years, about how we're going to do that. And I'm excited for the next 40 years.
So you brought up an interesting point, and you keep referring to your deployment or your combat support or combat mission. So is the vet center, can it only be utilized by combat veterans? What if I was an airman and deployed to an air base in Saudi Arabia? Obviously, I never pulled a trigger a day in my life. My mission was to service aircraft coming in and out of my air base in Saudi Arabia. am I eligible for the vet center?
Yeah. So my answer to you is this. You and everyone who's listening and watching this right now, contact us. Call our national call center. Connect with us. And we're going to connect you to your local vet center. Then you're going to get connected with somebody like me, a vet center director, probably. And I'm going to pick up the phone and actually talk to you for an extended period of time, for as long as it takes to get you connected to where you need to go.
Okay.
Does that make sense?
It does make
right.
sense.
So you know this, and all the veterans who will listen to this right now, they know there's that 10% of people in your military unit you can always turn to. You can always turn to, you can trust. You know what they say, they're going to do something, and they do it. They follow through with things. So that's what we're doing here, right? So if you're not technically eligible for a vet center, doesn't mean I'm not going to help you.
Okay.
I'm going to get you connected to where you need to be.
Well, I think that's an important point.
Yes.
Because sometimes, we do get so focused in, especially in the last 20 years, obviously, on deployments and combat tours, or, I was offshore in Vietnam, Blue Water Navy, that we do forget that our second largest population of veterans in the country right now is Cold War veterans. Those individuals who served from 1975 to, the start of the Gulf War, the Gulf War I, in 1990. So, you had that 40-year window when, we weren't deploying but, people served, obviously, and were overseas. And, I always use an example, I probably experienced more military trauma in training than I ever did in combat.
It can happen anywhere.
Right. I saw and experienced more individuals losing their life in training accidents than I saw in combat-related deaths. So you have that whole aspect. So I think it's important for veterans to understand that, okay, I didn't go to Baghdad, I wasn't in Afghanistan, or I didn't go to Gulf War I, or I wasn't boots on the ground in Vietnam, but there's still services that are out there.
There's still services out there, and the good news here is I had the fortune of actually training here at we're filming this at the Bedford VA, and I actually got to train here for a little bit, and so I worked with those veterans that you're talking about.
Right.
You know what I mean? And so that's the beauty of our partnership and our communication and our connection and our bond with our teams at VA, right? So if a veteran is not going to fit the specific eligibility for the vet center, no worries. We're going to get you to where you need to go. And the good news is, I'm in Boston. VA Boston healthcare system is a phenomenal system.
Yeah, one of the best in the country.
Phenomenal system. Amazing people working there. I'm really proud of what they're doing there. And so I get to reach out to them and say, hey, I have this veteran who served during this period of time. Let's get them connected. Roger that, and we'll make it happen.
Okay. Now, I think another interesting point you brought up, and I really want to harp on, because a lot of veterans, especially like we talked about, those that are still serving, they're leery about seeking services because, one, stigma, but also could it cause them to be non-deployable?
Sure.
So if I come in and tell you that I'm experiencing trauma and I'm really having a hard time, is that going to be communicated back to my command to where I'm not able to carry a weapon, so I'm non-deployable, so I'm basically ineligible for my MOS or job specialty? So I think, obviously inside the VA there's HIPAA restrictions, but at the same time, if someone's a danger to themselves or others, then the therapist is still required to reach out to maybe law enforcement. How about, what's the restrictions or stipulations at a vet center as far as that information that I share with you on a day-to-day counseling session getting into the community?
Sure. And so the concern is real, right? You're highlighting a real thing,
right?
A real anxiety that people experience. And I know this because when I was on active duty serving with the Navy, I was asking questions like fitness for duty, suitability for duty, right? So these are real questions for folks who are actually actively serving. And then you have special communities, as you know as well, special communities like aviators and the like, who have
law enforcement, or right.
So the concern is real, all right. And the short answer to your question is, a veteran who is still wearing the uniform, right? Because they're just eligible, they're wearing the uniform. They should rest assured that that we understand, we connect with the issue around trust. We connect with the issue around confidentiality. We have licensed professionals and team that's going to ensure HIPAA compliance. And above and beyond that, because we started in 1979 when trust was low.
Was a factor.
Was a factor, and still is. Listen, we
sure
not in trust is a really important thing. It's and we've got to reestablish it. But for the vet centers, we got it. And so one of the reasons that was the case back in 1979 when we first started was this option to not be communicating with the VA at that time. Right. And so just an additional layer of that, not communicating with DOD, not communicating with VA, right? There was an additional layer of confidentiality that remains today. Without your express written permission, nothing leaves the vet center except for those stipulations by law, which you mentioned. But bottom line is a veteran, a service member should feel confident that when they connect with their local vet center, that their privacy and confidentiality is one of the most important things to them. And their safety, obviously.
Absolutely. And I think that's really a critical point because, as I said, if I'm currently serving in the National Guard, and I'm a part-time soldier in the National Guard, I'm a police officer in my local community full-time, the Guard's my part-time. But I've had a number of deployments, say to Afghanistan or Iraq or what have you, and I do have some issues. So my concerns obviously would be, if I come in and sit down and start to work through those issues, I obviously don't want that information getting back to either my Guard unit or, more importantly, my police department that may cause them to say, we don't know if you should be on the street carrying a gun, having a badge. So I think the confidentiality piece is so key. And I think that's the most important thing that a vet center offers, in my opinion, for those folks that are really seeking to sit down and seek help. What?
Yeah,
thoughts?
Listen, we continue to serve across the country. I know in Boston, we continue to serve our neighbors, our community members who are in these positions where they have this concern, and we do so with great integrity. And we maintain that trust that we established over 40 years ago.
Well, that's fantastic. I'm glad to hear that. And that's a really important point. I mean, the vet center is not there to take away your guns. I mean, that's the other thing we hear too. If I come in for counseling either at the VA or somewhere, my Second Amendment rights are going to go out the window too. I mean, the first thing you're going to do is get on the phone and tell my community folks that, hey, this guy's having issues, go take away his guns. And that's just not the case.
That's not the case. And I think, honest to God, if someone's watching this or listening right now who's never sat across from a psychologist or a counselor or whatever, this is literally, minus the video cameras and the microphones, but literally like sitting in a seat like this with somebody who looks like me. And this is what we're talking about.
It's a back and forth conversation.
This is what we're talking about. So, and if it's unknown, right? If you've never experienced that before, if you've never walked into a vet center before and actually met with somebody like me or my team, you're gonna worry about all these. And they're valid worries. But when you come in after that first, second, third session, you get situated. Or if you're just meeting with an outreach specialist trying to figure out, hey, how do I get my VA claim in, or how do I navigate this service dog thing, or whatever it is, we're going to be able to help you with that. And rest assured, the confidentiality piece is very important, and I think the vets can trust the vet centers.
I'm glad to hear that, and we really wanted to stress that point because it's an important mission that you guys have.
Thank you.
And it's a fantastic service that you offer for those people that really don't want to come into a VA facility for a myriad of reasons.
Yeah. Can I talk about that real quick?
Absolutely.
Yeah. So VAs are awesome, most of them, and the VA in Boston is phenomenal. Again, I walk in there, and obviously things are a little bit different during this period, but the vet center is also very unique in that it's got this quaint sort of living room feel, right? And we're in the community, so the Boston Vet Center, for instance, is above the Dry Dock Cafe and right near Southie. Okay. So we're in the community. We're embedded in the community. We're in, sometimes in shopping malls, sometimes in a house down the street. And so in terms of that privacy and that warmth and that kind of relaxed, casual sense, That's something also that I think is just really unique about the Vet Center
Right.
program.
You're not walking into a
No,
hospital
no.
setting.
And listen, when I got back in 06, I wish I knew about the Vet Center in Providence. It's actually in Warwick. But
It's actually in Warwick, yeah.
it's actually, but I wish I knew about that place. I would have walked in if I knew about it. So yeah,
It's funny you say that.
Yeah.
Same boat.
Yeah.
I mean, I really did not become, unfortunately, really did not become educated on my veterans benefits and what was available until I started to work with the VA. And that's really unfortunate.
Isn't that wild?
It's wildly
Yeah.
sad.
Sad. It's sad.
And that, I don't know about you, but when I came off duty in the Army, went through my ETS stuff, and there was nothing about the VA. It was basically making sure your DD-214 was correct.
Squared
and,
away.
Yeah, and all those dates were right, and your awards were right, and handed it to you, and
Yeah.
good luck to you, Joe, and
Yeah.
out the door you went.
Yeah.
And there was really, now TAPS today, the Transition Assistance
It's
Program.
actually a lot better. I
it's
went through it twice.
a lot better. Yeah.
The second time I went through it, it was actually super good. We practice interview skills, and
Right.
so it was actually better. But yeah, absolutely. The Vet Center, listen, we did a poll recently when I was with Mr. Ng at VA Boston, and we did a poll of about 1,000 VA vets who had called in for this call. And we asked about, do you know about the Vet Centers? Are you utilizing the Vet Centers? Only 40% of the folks had heard about it. So that's why I'm here today, because I believe in the Vet Centers, and I really believe that everyone who's listening to this, if you're eligible, you really need to reach out to us and give us a call.
Absolutely.
Yeah.
And now, how does somebody do that?
Yes.
Let's jump on that train real
Yes,
quick.
sure.
So I'm listening right now, and
Yes.
I'm like, okay, this sounds interesting.
Yes.
How do I figure out where my vet center is? What do I do?
Yeah. Simple. Again, you're working with Vet Center teams, where these small teams, it's, so you're going to literally give us a call. But first, because this may be shared beyond Boston,
It's shared well beyond Boston.
I want to make sure that we provide our national call center phone number, which
Good.
is 24/7. So if someone is listening to this program right now and they want to meet us, they want to meet their local Vet Center team, they should call the National Call Center at 877-927-8387, or they can visit vetcenters.va.gov and find their nearest vet center and get some information that way.
And we'll have that information down below so that folks can
Great.
can
I appreciate
continue to reach out and grab it and utilize it. I want to get back real quick to, we talked about it a little bit, but I really want you to dive into it more, and that is the uniqueness the vet centers offer for families.
Yeah.
So, I can come, you talked about marriage counseling or life-changing event counseling. Those are unique services to the
Absolutely.
vet center
Absolutely.
only. Can you touch on those a little
Yeah.
bit for us?
And so I'm actually a board-certified couples and family psychologist nationally. And so this is very, very important to me. And the vet centers are just so special in that we're walking the walk, right? So everybody recognizes that life is challenging, right? Various transition points, maybe even right now, all right? And so stress of current transitions, of a new marriage, a new relationship, a new child, of someone that you've loved for 50 years, right, who's getting sick, and you're a caretaker now, right? For all those reasons, or even just identify, hey, I want to have better communication with my spouse, right? For all those reasons, we want you to connect to your local vet center, because most of our vet centers have marriage and family therapists, right? They focus on this. They focus on helping veterans love better, right? And we don't narrowly define family. So if you're in a relationship with somebody, living with them, not living with them, a friend, a family member, if there's something you need to work on, it's related to your military service, right? It's a challenge. We want you to come in. We want you to work on those communication skills, right? We want you to be able to navigate conflicts when you're at home and trying to figure out what you're going to cook next. Like we want you to figure out how do you put the kids to bed, and be able to do that and still make time for each other and still have that emotional connection. And we especially want to be there for our Gold Star families,
Right.
and for our family members who have lost someone in service to our country. We want to walk beside them as they grieve, and for however long that is, we're going to be there for them.
That's critical, and that's an awesome benefit. And thank you for doing that, because I think sometimes, as time goes on, we do lose sight of our Gold Star families.
We have to remember, and remembering is not a once a year thing.
Right. It's not.
And our families live
Memorial
with us.
Day or Veterans Day only.
So we want to be with them, and we want to celebrate. And we want to celebrate these, the service and the honorable service that these men and women have served their country. So,
I think you hit an interesting point. And I just think back to my own life and my own experiences. I mean, I probably, like most of us, I joined the Army at a young age.
Yep.
So I was in military service when I was, in my early 20s. So I kind of matured and grew up in the military as an adult. And the military teaches you a lot of great skills, but emotional communications is definitely not one of them.
I didn't learn that in the Marine Corps.
Exactly, especially depending upon what you serve, what your job specialty is in the service.
Yeah.
You're constantly next man up mentality. Okay, we'll grieve later, drive on, accomplish the mission, all those kind of things. And then you're right, when you transition home, our spouses, our partners, they're looking at life completely differently, and if you can get yourself into real trouble, bringing that military mentality into your home. Whether with
everything
your children,
has a place.
Everything has a place. So
everything has a place. Do this way.
Especially if you've been deployed for a period of time. I mean, you're gone. Back in the heyday of the War on Terror, 12, 14, 16 months, and you remember, it's basically 24/7, 7 days a week, and now you're back, and it's challenging. It's challenging now to readjust in the sense of, okay, I have a loving relationship with somebody, and I need to communicate with them a whole lot differently than I communicated with my squad or what have you.
Yeah. Can I give a real quick tip on this?
Absolutely.
The two keys here is being able to, and this is what we work on, this kind of stuff, right?
And I think that's the key.
I'm working with couples right now on this stuff, and and they're awesome. They're doing awesome, actually. So being able to communicate in a way that you're sharing influence, which is tough for veterans sometimes. And I'm a veteran, so we understand.
Understand, absolutely.
And communicating understanding and emotional validation. These are the big pieces. If you figure that out, you're gonna be in a good spot. So, and how do you do that? Regardless if your deployment was 10 years ago, as many of our deployments have, 10 years ago, now at this point, right? And let's we not forget that there are men and women who are deployed right now.
Right this minute.
And who will be coming back. And however, a lot of the folks we're connecting with right now, 10 years ago, the deployment, right? The impact is real. And it continues to change and morph through time, right? And with new challenges and new opportunities, maybe buying a house, maybe trying to find the next rental, whatever it is, it's really, really important to connect with the subtleties, right? Because everyone's really focused on, rightfully so, focused on the treatment of post-traumatic stress disorder, right? Rightfully so. We're focused on making sure to do that, and we're making sure that we're keeping veterans alive, and we're going to do the best that we possibly can to do that, right? And we want to be able to enhance people's life now. The VA has a fantastic program that they've been working on for a while now, which is the Whole Health Program. I'm really into it. I'm into it as a Marine, and I'm into it as the director of the Boston Vet Center because I believe in this idea of mission, aspiration, and purpose. Right, which is sort of a hallmark of this Whole Health Program. And this is what we're about. How do you and your family identify what's most important to you right now? What is the most purposeful, meaningful thing to you right now? What are the goals that you have for you and your family right now? How can the Vet Center help you achieve those goals? That's why I want people thinking about that too.
And you're right. And they need to be thinking about that. And the great aspect of it all is, I can come in with my spouse or with my partner and we can sit together and talk with you and get that one-on-one feedback together as a couple. Or as a family if my kids have concerns or whatever. That's I think, and that's where I really wanted to come back and talk about this. That is such a unique aspect of the Vet Center that's just not affordable to a veteran.
Oh, and in the private sector, it's very, very hard to afford that.
Right.
Right.
And also, it's just not available for the most part at a VA medical facility.
Yes.
We have awesome programs to help the veteran, but we don't, I think we've come now to rely on the vet center to do that family portion. And it's critical that people understand that, you don't have to go through this alone. You can come in as a family
Yes.
and sit there with someone like yourself and get pointed in the right direction.
Yeah. We don't want to be alone with
Exactly.
things. We don't want to be alone with things.
That just leads to trouble.
Yeah. So we don't want to be alone with thoughts. We don't want to be alone with goals and aspirations. We don't want to be alone with that stuff. We want to make sure we're sharing that with the people who are around us. And if we don't have those people, then we need to connect to the vet center, because we're going to be your people, so you can make that bridge, make those connections, expand that social connection, right? Last thing we need is for people to be alone with stuff. We don't want that, right?
And I think a lot of veterans do internalize that. I know I could have used it, way back. Luckily for me, my spouse kind of understood life. She was, or she still is, the daughter, the sister, the wife, and now mother of a veteran. So my wife got it, and thankfully she did.
Yeah.
Otherwise, I don't know if somebody else would have been as understanding and would have kicked me to the curb a few times.
Yeah.
But so it's critical that you come in and get these services. It's just wonderful that you guys offer that.
Yeah, it's critical that family members who may be listening to this right now
have an option.
I want us to be talking to them.
Absolutely.
You know what I mean? Because they're part of this, right? So, I get quite a few phone calls from family members themselves directly.
Perfect.
And then I say, hey, get the veteran grab the veteran, put him on the phone. We'll talk to we'll
Let's
figure
go.
it out. We'll figure it out.
Well, we always laugh because we here in the healthcare side of the house with VA work diligently with caregiver support, family members. Because a little known fact, but more than 90% of all healthcare decisions are made by the female in the relationship.
Okay, yeah, that makes sense.
Most guys could give two hoots. I mean, unless you have I break my leg, most guys don't care about
We didn't learn
Right.
to care.
Right.
We didn't learn to think in that way. We were socialized.
Put a Band-Aid on it, take some Motrin, and drive on.
Yeah, in general, yeah.
But so it's critical that we do reach out to family members, as you're talking about, and let them know that they can reach out to you and say, how do I get my veteran pointed in the right direction?
And I want to be abundantly clear right now that the Vet Center program is an incredibly inclusive place. So we work with same-sex couples. We work with anybody. We're an entirely inclusive place. And we want to make sure that everybody who's listening to this right now knows that VA and vet centers serve all who serve.
Exactly.
Sure, that's the point.
That is a great point. And once again, I think what's critical, what you've already talked about too, is coming back to that aspect of confidentiality. So no matter what your situation is, you come in, you get the services, and those services are between you and your provider. They're not, nobody.
And your family, if they're there.
Right.
Yeah.
But my point is, we're not in the business of broadcasting that to the community.
Yeah. And I at someday we'll get beyond the stigma piece. We've made tremendous progress.
We have.
All right. I've seen it on the active duty side, right? The reason why on the active duty side people like psychologists are busy is because the stigma's down, right? So that's good. We want to keep the stigma down. We want it to go away. Because I would love for people just to think about this as a community resource, and if they're going to get some therapy, get some readjustment counseling, cool.
Great.
And it's all good. It's all good. It's all health promoting. It's all life promoting.
I think the other great point that you said earlier is that, outside of the counseling piece, you guys are a fantastic conduit to help veterans file a disability claim. How do I go about what is comp and pen?
Yeah.
How do I get into the hospital? I think I would like to use VA healthcare.
Yeah.
What's the difference? What's VBA, VHA, NCA? The three pillars of the VA. They're very confusing. So I go here to file a claim, but I got to go here for healthcare, and then the cemeteries are over here. So you guys are a fantastic conduit beyond the counseling piece to kind of break down those barriers and help people understand what exactly the benefits that are out there,
Yeah.
and then help them get acquainted and into their benefits.
Yeah, the barriers are real.
They are,
They
unfortunately.
persist.
They do.
And things like the sit rep and other ways that we're reaching out to our communities, I hope, bridges that gap. Let me say a little bit about this comp and pen, or submitting a claim. Just let me say a little bit about this. The process, depending on, there's lots of different ways you can get through that, along that
Absolutely.
path, right? There's lots of different ways. There's VA, there's Vet Center, there's VSOs, there's veteran national service organizations, VFW. There's lots of ways to get it done. But I guess what I want to say is the comp and pen is a way for you to share with the VA and get on record your experience in the military. It's being able to communicate what impact it had on you. All right. The process itself is an evaluation. All right. It's not necessarily the support
Right.
to get the evaluation.
Right.
So if anyone's
It's not set up for that. It's set up to evaluate
Exactly.
issues you had.
and that's what it's supposed to do.
right.
Okay. But I want anyone who's listening to this right now, if you're thinking about, if even it's a faintest idea that you think you're going to submit a claim, if it has to do with hard memories, call your vet center. Okay. Come in the vet center. Connect with us. Let's talk about your military experience first. All right. Start to finish. Right. Why'd you join? What was it like? What was training like? Where'd you go? How'd you serve? What happened when you served? What was it like coming home? What was the impact? That conversation in that supportive, relaxed environment with people who care and who also licensed professionals will support your ability to make it through that process. Because it can be hard, particularly if you're putting in a claim for PTSD or something. It could be hard to be on the other end of that evaluation and be answering questions about one of the hardest moments of your life.
Right.
So the vet center wants to be there to support you on the back end, but even beforehand, because we want to be able to help you and support you.
Get you pointed in the right direction.
So I really, I implore anyone who's listening or watching this right now, contact your vet center if you're thinking about submitting a claim. And if it's connecting to other community partners or whatever that might be, or just talking about it. It could literally be one time. Bring your DD-214. If you don't have it, we'll find it.
Right.
All right. Come in and have a conversation. It might just be one time to talk through what your experience was in the military and just have it heard, have it validated if you're going to put a claim in.
Right. That's a great point.
Yeah.
And that's another wonderful avenue, because the claim process can be confusing. Not can be, it is confusing.
Yeah. And it can be hard emotionally.
It can be hard emotionally,
Yeah.
Exactly. And it helps you get pointed in that right direction to hopefully be successful with your claim. Kind of shifting gears a little bit. You talked about it a little bit, or you mentioned it earlier. Okay, we've got the brick and mortar vet centers.
Yeah.
What's a mobile vet center?
Yeah.
What do people see? What is that all about?
Yeah. So if you showed up to the Boston Marathon over the last few years, and probably before that, you would have seen a mobile vet center, okay, in downtown Boston, all right, at the Common, actually. So it's basically an opportunity for us to be in the community, celebrating things worth celebrating, supporting when we need to support in crisis or emergencies all across the country. And so we've got 83 mobile vet centers, and they're like really awesome, like souped up RVs, basically.
Yeah, they're tricked out RVs, exactly.
Yeah. And usually it's there's going to be a combat veteran who's an outreach specialist who, again, has a very deep connection and understanding of all of the things we're talking about
Everything,
today.
right.
And is going to be able to streamline the process. You might just be walking down the street at an event or something, and you see a mobile vet center, and you go say hi, whatever, you get some, and you connect. You could get literally, because along with that outreach specialist, there's often one of the counselors there. So literally, if you are a veteran, I mean, you could be walking down the street at an event, go talk to the team at the mobile vet center, and actually get counseling right there, get stuff started, get squared away on the claim side, let's reduce all the barriers. Let's make this as easy as possible. And that's what the mobile vet centers help us do.
And they're awesome. We do a lot of work with the mobile vet centers in our outreach efforts. I would say easily more than 50, 60% of our outreach efforts are joint efforts with the mobile vet center.
Awesome.
Because you're right, it ends up being a one-stop shop scenario for a veteran and their family.
Yeah.
You're right. And I'll use an example. We're always out at the Eastern States Exposition, the Big E, out in West Springfield, Massachusetts, the 4th largest fair in the country. Unfortunately, not this year. Unfortunately, but we're set up there and talk to literally thousands of veterans, and it becomes one-stop shopping. The vet center's there. You're right. It's an RV. So if somebody comes up and is having an issue, you can literally go right into the privacy of the RV, close the door, and in a very comfortable setting, total privacy, have the conversation you're talking about.
Yeah, and we have access to VA systems as well, and so we could troubleshoot things at that time too. So we want to make it as accessible as possible.
And I think what we find though is, once again, battling that stigma issue. A lot of times we'll see vets don't want to approach because they're after me, or they want my information, and that's just not the case.
Yeah.
It's a resource.
Yeah.
It's a community resource, and that's what it's doing there.
Yeah. I mean, the beauty of working for a vet center, and I tell my team, we talk about this often, all right, is that you literally get to wake up every morning, go to work knowing that you're going to have an impact in somebody's life, in a veteran or family member's life. And that's what we get up every morning to do. And when we're at a mobile vet center, we're out in the community and we're trying to reach out, it's because we genuinely care and we genuinely want those veterans and family members to get connected and get the resources they need, and also to support them in their goals. So we also have what are called outstations and community access points, and that just expands beyond the brick and mortar vet center, our ability to be in places in the community where maybe there's more folks who want to work with us. So, maybe as an example, for some amount of time, the vet center in Boston, right? I was going to Newton, so the suburb of Boston, and meeting folks out there, or we were going to Roxbury, or we were going to UMass Boston. So vet centers are also beyond that vet center, and beyond the 83 mobile vet centers, we're also in the community itself. Wherever the need is, we're trying to be there.
I think that's so critical. And I'll give you an example. I know when we started our extensive outreach efforts here in New England, as we sit here today talking about it, when we first started those back in late 2009, early 2010, less than 35% of veterans knew about or understood their benefits.
Wow.
That's not, and I'm not talking, like you said, 1979. I'm talking 2010, 2011.
Yeah.
Literally just yesterday.
Up tempo, everything. Yeah. And that's the case. Yeah.
And so we've worked very, very diligently, as you guys have. And I think that's the critical piece to all this. You got to be in the community. You got to get the information out there, and you got to help veterans understand, and get over those myths like, I wasn't a combat vet, so I know I'm not eligible for anything, especially with our female veteran population. A lot of them feel that way because I never was in a combat job, so I know I'm not eligible for benefits.
Well, let me say this we are committed to serving women veterans. We are committed to serving women veterans, and we, every week, my team gets together and I'm sure vet center teams across this nation, to think about what can we be doing better, right, to make this space more inclusive, more inviting. Any veteran, regardless of gender, regardless of sexual orientation, regardless of gender identity, understands that we're their place. We're a safe place. We're their place.
You served. We want to help you.
Yeah. We're again, most of us are veterans too, right? And we've already walked that bridge, right? A lot of us. So we have a sense we care. We know how it's done. We want to support you in that transition. And we want, again, most inclusive place, all right? Anybody. We're committed to that.
All right, Greg, thank you so much for being here today.
Thank you for having me.
We appreciate your service for what you do currently, but also you served our country as a veteran. We appreciate your service. Is there anything you want to make sure gets out today to the audience in general?
Yeah, I think now more than ever, we have to come together as a community. And I think vet centers are understanding of the strength in community. And so let's come together. Let's connect.
So please do. I mean, I think it's important. The information is right below on how to connect with a vet center. Please reach out and get those services that you've earned and deserve.